Epididymitis is a medical condition characterized by inflammation of the epididymis, a long, coiled tube located at the back of the testicle that stores and carries sperm. This condition is one of the most common causes of scrotal pain in adult men and can affect males of all ages, including children and older adults. It is typically caused by infection or, less commonly, by non-infectious factors such as trauma or autoimmune disease. When untreated, epididymitis can lead to serious complications, including infertility or abscess formation. Anatomy and function of the epididymis. The epididymis is an essential part of the male reproductive system. It connects the efferent ducts of each testicle to the vas deferens and plays a key role in sperm maturation and transport. It is divided into three sections: the head, body, and tail. The tail of the epididymis is where most infections begin due to its proximity to the vas deferens and urethra. Causes of epididymitis. Epididymitis can be categorized based on its cause. 1. Infectious epididymitis. This is the most common form and can be due to sexually transmitted infections, STIs in younger, sexually active men. Chlamydia trachomatis and Neisseria gonorrhoeae are frequent culprits. Urinary tract infections, UTIs in older men or boys. Bacteria like Escherichia coli may ascend from the urethra or bladder. Mumps virus. Occasionally, viral infections can also affect the epididymis, particularly in prepubescent boys. 2. Non-infectious causes. Trauma or injury. Injury to the groin may cause inflammation. Chemical epididymitis, caused by urine flowing backward into the epididymis due to straining or heavy lifting. Autoimmune reaction. Rarely, the immune system may mistakenly attack the tissues of the epididymis. Risk factors. Several factors increase the risk of developing epididymitis. Unprotected sexual activity. History of STIs or UTIs. Use of a catheter or recent urological surgery. Structural abnormalities in the urinary tract. Prolonged sitting or activities like heavy lifting or cycling. Enlarged prostate, in older men. Symptoms of epididymitis. Symptoms can appear suddenly, acute epididymitis, or develop gradually over time, chronic epididymitis. Common signs include scrotal pain and tenderness, usually on one side. Swelling and redness of the scrotum. Painful urination or burning sensation. Frequent or urgent need to urinate. Painful ejaculation or intercourse. Blood in semen. Fever and chills, if infection is present. A lump in the testicle. In chronic cases, the symptoms may persist for more than 6 weeks and are often less severe but more persistent. Diagnosis. Diagnosing epididymitis involves physical examination. The doctor will check for swelling, tenderness, and any abnormal lumps in the scrotum. Urinalysis and urine culture. These tests help identify bacterial infection or STI. Urethral swab, to test for sexually transmitted organisms. Ultrasound. Scrotal ultrasound with Doppler imaging is often used to differentiate epididymitis from testicular torsion, a surgical emergency. Treatment. Treatment depends on the underlying cause. 1. Antibiotics. For bacterial epididymitis, antibiotics are the first line of treatment. The type and duration depend on the suspected bacteria. For STIs, combination therapy with ceftriaxone and doxycycline is commonly used. For UTIs or enteric bacteria, a fluoroquinolone like ciprofloxacin may be prescribed. 2. Supportive care. Rest and elevation of the scrotum. Cold packs to reduce swelling. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen for pain and inflammation. Avoiding sexual activity until the infection clears. 3. Surgery. Surgery is rarely needed but may be required if an abscess forms. The condition does not improve with medical treatment. There is suspicion of chronic or recurrent epididymitis. Complications. If untreated, epididymitis can lead to serious complications, such as chronic pain, testicular atrophy, abscess formation, infertility, epididymitis, infection spreading to the testicle. Prompt treatment usually prevents complications. Prevention. Preventive measures include practicing safe sex, use of condoms, prompt treatment of urinary or sexually transmitted infections, good personal hygiene, avoiding heavy lifting or straining if prone to chemical epididymitis. Conclusion. Epididymitis is a painful and potentially serious condition affecting the male reproductive system. It is often caused by infections, particularly STIs in younger men and urinary tract infections in older men. Prompt diagnosis and treatment with antibiotics and supportive care typically lead to a full recovery. However, chronic or untreated cases can result in long-term complications. Awareness, early medical attention, and preventive practices are crucial in managing and avoiding this condition.
Thank you for watching. Please subscribe our channel.